Good afternoon, ladies and gentlemen. Over this last 3 months, a lot has been asked of all of us in the name of public safety, and the vast majority of you have followed the public health advice to contain the spread of COVID-19. You have taken the proper health precautions, you have altered your behaviour, you have limited your interaction with family and others, you have changed the way that you worship, the way you exercise, the way you relax and the way that you shop. None of these decisions have been easy, but your selfless actions, your determination and self-discipline has undoubtedly had a positive impact. Collectively, we have been able to drive down the rate of infection and avoid our hospitals being overwhelmed by COVID cases, a horrific outcome which some countries faced, but we have managed to avoid. Businesses have unquestionably played their part, with many shutting their doors in a bid to prevent the virus from wreaking havoc amongst their workforce and the wider community. And throughout our response, the Executive has based its decisions on COVID-19 around health, economic and societal impacts, as our plan has stated right from the beginning. Saving lives has always been our priority, but increasingly our focus has been turning to livelihoods. The coronavirus pandemic has had a devastating impact on our economy. The longer people are removed from the labour market, the greater the risk of long-term scarring on our economy and wider society. So we need to take action to help the economy recover, and this will be gradual and in stages. Our key messaging has recently changed to stay safe, save lives, and work safe, save lives. Some elements of retail have been permitted to open over recent weeks, and others have opened this morning. We have received a further update on the latest expert scientific and medical advice from the Health Minister and his team of advisors today. And if at our next executive meeting on Thursday, the advice remains that the virus has been kept under control, the Executive has agreed that the rest of retail in Northern Ireland can reopen from this Friday, the 12th of June, apart from indoor shopping centres where there are additional issues to consider, and we will consider those issues at our meeting on Thursday. Progress along our economic recovery pathway will be reliant on controlling the rate of transmission of COVID-19. Social distancing and respiratory and hand hygiene will be key, and the Economy Minister Diane Dodds will continue to engage with the retail sector and assist with preparations ahead of reopening and how risks can be minimised. Many have already made adaptations. Those services such as hairdressers and barbers, where there is a close personal contact, will be considered in subsequent stages of our COVID response. A coordinated approach is required to help businesses get back up and running and workplaces operating safely. Issues such as childcare, public transport and management of footfall on high streets will also need to be considered. We will have further broader discussions at Thursday's executive meeting around moving through the other outstanding elements of Step 2 and progressing the Executive's roadmap to recovery and greater normality. We are all very mindful in the Executive of the desire of families and friends to meet, and we will consider that later in the week on Thursday as well. We have looked at the approach that has been adopted in other parts of the world, including in New Zealand, and we have asked officials for advice on the bubble concept. Deputy First Minister and I have also agreed to establish a working group involving churches and other faith groups to discuss how best to achieve the gradual reopening of places of worship safely, step by step, in recognition of the importance of faith in people's lives here in Northern Ireland. We do applaud the effort of the Northern Ireland community and what they have done in relation to responding to COVID, and we encourage you to continue to act wisely and safely, and in that way we can make more progress. Michelle.
Thanks, Arlene, and I'm really pleased to start my contribution to today's press conference by saying that for the second day in a row there's been no recorded COVID-19 related deaths, and that's a very positive situation. It's very encouraging news and very welcome news, and gives us all some hope that whilst we remain cautious and careful and vigilant in the time ahead, that after the hard struggle, which has been a hard struggle for everyone, that we can see some glimmer of light at the end of the tunnel. So the Executive Ministers met again today to discuss and review our pathway to recovery out of COVID-19. And we again recognise and don't underestimate the impact that the severe restrictions have had on everyone right across our society. So we want to thank each and every one of you for your continued patience. As we manage our pathway out of this coronavirus pandemic, it requires a collective effort with the community. The last thing we want or we need is to have a spike in the spread of the virus or to provoke a second wave which attacks those most vulnerable, heaps pressure on our health service and our frontline workers, who we salute for their bravery, professionalism and self-sacrifice over these past few months. Over the course of the past number of weeks, the Executive has made minor easements to try and bring some type of normality back into people's lives and to strike a balance between restarting community life, minding people's mental health, minding people's health and well-being, protecting public health and protecting livelihoods. This is all a very important balance, and decisions are taken carefully with the expert advice and scientific evidence provided to us as ministers. We will meet again tomorrow in north-south basis to discuss recovery efforts, and which are now moving at a steady pace and on a forward trajectory. We must be cognizant of what is going on around us and the fact that we do live on an island. We must also give due consideration to the wider effects the restrictions are placing on our economy and our society. The scientific evidence and medical advice to the Executive today was that, given where a number of indicators on the course of the epidemic are where they're at present, we do in fact have some latitude to make further relaxations. The Executive needs then to take decisions on using that headspace that we now have to introduce relaxations that will be of the lowest risk but the greatest benefit to our economy and to our society. In trying to rebuild our economy and support our businesses as best as we can, we want to avoid a situation where our local small retailers are at a competitive disadvantage. And the advice is that opening smaller retail outlets where social distancing and hygiene measures can be implemented is considered to be relatively low risk at this time. So we collectively as an Executive today have decided that we do intend to permit the reopening of smaller retail businesses from Friday. We are making this announcement today to give sufficient preparation time for those businesses to be able to reopen safely. This change to the regulations will be confirmed after further discussion at the Executive on Thursday. That discussion will be part of a special meeting of the Executive where ministers will come together to discuss our short, medium and longer term strategic plan for recovery. We need to be realistic. Our economy won't rebuild itself. It's going to take a coordinated and sustained approach over a lengthy period of time to recover. We also want social and economic revival to go hand in hand. So we need to be having these conversations both within the Executive and with the business community and society as a whole about how we start to recover and how we start to become stronger. An enormous amount of work is being done across departments with stakeholders as we look to the future. But no minister or no department is working in isolation. The decisions we take throughout the recovery process will have a ripple effect on many other aspects of public service. Thursday's special meeting of the Executive will consider that strategic focus and a joined-up effort that's needed as we move forward. And as Arlene has said, we're also going to take a strategic look at the situation around family contact, families and friends, education and, of course, ensuring adequate childcare provision. These are all going to be critical in restarting our economy. Our number one priority remains to save lives, and it is critical that in everything that we do, that we're charting the safest course through our response and recovery as possible. Compliance with the public health message is key, and safe working practices are absolutely crucial. No employer should be putting either their employees or the wider public at risk through their operating practices, so we must work with all sectors concerned to make sure that all businesses are operating safely and in line with the relevant guidelines. Our forward progression is good news, but we must remain cautious. We must continue to protect ourselves and each other to try to get through this. But as we have said before, we will not keep any restrictions in place for a moment longer than they are required. It is vital that we retain our flexibility that's needed, which allows us to respond to the complex emergent situation based on all the current relevant evidence. And we need to be prepared to step forward and step back where it's necessary. There will be times when there are strongly held but contrasting views on the right decisions about the next steps, but we will continue to do right by the public and we will continue to try to continue with the forward momentum which we now have over recent weeks. Thank you.
Good afternoon, Ministers. Tracy McGee, UTV Live. This decision to relax for retail comes just days after the Taoiseach announced that he was going to be fast-forwarding the roadmap for Ireland. What would you say to people who say that today's decision is more about finance than science, maybe even a bit of politics?
I wouldn't agree with that at all, Tracy. I don't think you would expect me to agree with that analysis. Both Michelle and I are engaging with our own Chief Medical Officer and Chief Scientific Advisor. I think last week we met them on 3 occasions. Obviously, we had an engagement with them this morning again. And we have always said that we will not move unless we have the backing of our Chief Medical Officer and the Chief Scientific Advisor. And they're very clear that there is now headroom for us to able to move. And you will recall when we launched our plan back on the 12th of May, that we were very clear that the advantage of not having dates attached to our plan was that we could be flexible and that we could move, sometimes in a faster way, sometimes we'd have to pause and take account of what was going on in terms of the hour number, in terms of the number of hospital admissions. So I think this shows the benefit, actually, of having a flexible plan and being able to move in a way that reflects where the disease is in society currently in Northern Ireland. We'll come together on Thursday and we'll have a more comprehensive look across all of the different sectors. We're doing that on Thursday, and as I say, we are going to very much, because I know one of the key elements we're asked about often is the fact that people cannot have interaction in their family's own homes. And so we are looking at this bubble concept, which you will have seen in New Zealand, which seems to work very well there. And so we're looking right across the piece to see what works for Northern Ireland. I make no apology for that. I think that's the right way to move forward. And certainly the flexibility is there within the plan to allow us to do this.
Yes, Tracy, I think that, you know, we said from the outset, whenever we set out our pathway to recovery, we said one of the beauties of our plan was the fact that it had that inbuilt flexibility that allowed us to respond to any given circumstance at any given time. I think these further relaxations demonstrate that that's the plan working. So I think that I'm delighted that we're able to make some further progress today. I also know I'm very conscious of the fact that people want to know more about, you know, being able to get together with their families. As Arlene said, you know, people want that information also. So we're actively looking at that, but we're doing all of this based on the sound medical and scientific evidence that we're being given, and we were told very clearly from the Chief Scientific Officer that we had headroom to be able to move on things that were deemed as lower risk, and this is one of those areas where we've been able to move today. And we continue to take that medical advice, because if you remember, our plan said that we need to get the disease under control, that we needed to have capacity in the health service to be able to deal with cases, and all those things are obviously we're actually meeting all those objectives which we set ourselves. So it's right that we move them whenever we can.
Well, then, as a follow-up, you say that you are looking at the idea or loosening that last part of phase 1, whereby people can meet indoors. Surely you'll have to move on that quickly. It's illogical to say to somebody that they can meet their parents or their grandparents standing in a shop, but they're not going to be able to meet those relatives in their own home. Surely people won't understand that, so you'll have to move on that quickly.
Well, I think the key for us is to explain the difference between an interaction, albeit a fleeting interaction in a shop where all of the social distancing and hygiene has been put in place, and there will be guidelines released by the Minister for the Economy around all of that, and going into one's own home and sitting down and having a cup of tea and being there for a considerable length of time. So I think there is a difference, Tracy, in relation to that. I'm not saying that we're not under pressure to deal with this issue. I'm under pressure, Michelle's under pressure from a personal point of view to deal with these issues. We want to deal with these issues, but again, we are being led by advice that has been given to us. The reason we're looking at this bubble concept is that it's not just for those people who don't have close family and they just have their close friends, we want to explore how we could move that forward so that you have an exclusive group that can be inside together, and then if someone in that group gets coronavirus, then everybody in the bubble has to self-isolate. So that's the idea behind that, and it's a way of dealing with it in a meaningful way, and I think it's something we should consider, and it's something we will consider on Thursday.
And I think even as we move forward and more people are going back to work, some sectors opening up again, childcare becomes a huge issue in the middle of that. So the bubble concept also allows people to have a solution to their childcare issues as well. So this is all part and parcel. I mean, we have to come at all these things from a very holistic point of view. You know, public transport has a factor. The more things that are opened up, childcare, as I said, is an issue, or schools is an issue. So we're looking at all these things in the round, but we will move as quickly as we can, and if we can move later in the week, then that's what we will do in terms of these things. We've said that we've commissioned this piece of work around this bubble concept to see if it's something that actually we can make work.
Go ahead, Jane.
Afternoon, Ministers. Jane McCormack from BBC here. The news on shops will be very welcome to a lot of people today, but some people will feel that it is unrealistic for hotels and tourist accommodation to have to wait until the 20th of July, when we know that at the end of this month in the Republic, hotels, restaurants and pubs are going to be able to open. Was the advice that you received today from your scientific advisors that you couldn't move on this today?
Well, it's not that we couldn't move on this today. I think that we are having a more strategic look at all of these issues, from how people can move house safely, how they can enjoy going to hotels and restaurants safely. We'll be discussing all of these from a more strategic point of view, Jane, on Thursday. But I mean, when we said the 20th of July, I think if you look at what we said at the time, that was to give an indicative date in terms of where we felt people would be safe to go back to hotels. But we also said at the time that if we could bring that forward, we would bring that forward. That's what has happened in the Republic of Ireland. They have decided to collapse their 5 stages into 4 stages and therefore bring forward the date of the 20th of July to the 29th of June. We will have to look at what our advice is in relation to all of that. But I mean, it's something that we will be flexible on. As I say, the advantage of our plan is that we haven't put indicative dates in place. The only reason we put an indicative date in place for tourism was to allow them to have pre-bookings, and they were very keen to have that. So, you know, if we can move forward in relation to tourism, in relation to the openings of hotels, caravans, all of those things that we've talked about, we will move forward, and I very much hope that we can.
And just to concur with that, that response, I mean, I think it's important that we recognise that we have this flexibility, and that if we can move quicker, we don't want any hotels here to be at a competitive disadvantage. We want to be able to move forward. So I think it's important that we are very strategic in our approach to this, because everything we do has a knock-on impact, it has a cumulative effect. So that's why we are coming back to a more strategic approach to this on Thursday, when we have that fuller conversation around all these things. And as I have to keep repeating it, but it is worth saying again, we won't keep restrictions in place for a day longer than necessary.
And just as a follow-up to that, what might seem like flexibility to the executive seems like confusion to a lot of members of the public. And moving back to the indoors visits, I know that you want to move on it as quickly as you can, but some people might ask, why did you ever include it in step 1 of your plan when we're already in parts of step 2 and we haven't even touched this aspect yet?
And I think that's a very fair question, Jane. And I mean, I have looked at that and looked at the fact that it's in step 1 and we're moving to step 2 and some other issues. I think it was a hope that we could include it in step 1. We haven't been able to, based on the medical advice. And again, when we launched our document, we said that some parts of the steps might happen at different times. I regret that we haven't been able to allow that to happen. I regret it personally. I regret it for my constituents. I regret it for everybody in Northern Ireland that they haven't been able to move forward in relation to that. But I have always said we will be led by medical advice, and the medical advice to us at the moment is that because the virus lingers indoors on a longer basis, and because if you're in a domestic situation, you are more relaxed and not taking the advice in a way that you might when you're visiting a shop or doing other things. I hope we can move on it sooner rather than than later, because I know people have been waiting a long time to hear us say those words.
Yeah, I mean, it's all about a balance, about trying to prevent a second wave coming as well. So obviously we're trying to work our way out of this, which we always, we always put our hands up and said that working our way out of it was going to be more complicated than actually going into it. So I think that's where perhaps then people get anxious and be confused about what it is that we're doing. But what we're doing is we're being guided by the science, and we have to listen to what's being said in terms of the scientific and medical advice, and we will move as quickly as we can. But the other thing still remains. We need compliance as well from the public, just to try and get us there quicker. But I think Thursday's meeting will be that strategic discussion that we need to have around, if you have headroom, if the disease spread is at such a level and you have space to move, we as an executive have to prioritise the things that we move on. So we're trying to get the balance right between family time, being able to have those personal connections, but then also the economic end of things. So it's all about balance.
Yeah, Michael, go ahead.
Yeah, apologies, struggling with technology. Can I just ask, in terms of face coverings, why did you not make a recommendation around whether or not they should be mandatory on public transport?
Do you want to take that?
Yeah, well, the Infrastructure Minister actually had brought a paper today to the Executive to ask for a conversation on this, and we've agreed to come back to give a very considered view on it. I mean, we've previously, when we have sought medical advice on scientific advice in terms of face coverings and the merit or not of them, we've been told that, yes, okay, they're helpful, they can give people some reassurance in terms of moving around. However, we need to watch that people don't lapse into a false sense of security that mean that it'll not spread the virus. So we have that still under review, Michael, and certainly we'll be coming back to that discussion again later in the week.
Do you want to ask a supplementary, Michael?
Thank you. Yes. Do you have any data yet around actually how dangerous or safe it is to use public transport at the minute during the pandemic? Is there that level of detail?
Well, as you know, there were plans put in place at the beginning of the pandemic to reduce the numbers of people travelling. And of course, because people weren't travelling to work, the numbers organically went down in any event. We have, as an executive, I think it's a number of weeks ago now, recommended that people should wear face coverings on public transport or indeed in shops. But there is a body of evidence that says, Michael, that actually when people are wearing face coverings, they think they don't have to take the other hygiene regimes as seriously, and that's not the case. And it does concern me when I see people wearing face masks, but they're not socially distancing, and that's wrong. You have to continue to be involved in social distancing even when you're wearing a face mask, because the mask doesn't protect you, it only protects others from you breathing upon them. So I think people need to realise that, and of course we will have that discussion around face masks again on Thursday when we have more advice from our advisors.
Hi, Ministers. Police at the weekend issued around 80 fines to protesters at Black Lives Matter rallies in Belfast and Derry. I think that's the highest number of fines issued in a single day so far. Are the Ministers concerned at the optics of what were mainly very young people being fined when police have previously taken a different approach to large gatherings on beaches and parks and even outside retail premises?
Well, I think the way in which the police operation happened on Saturday was a proportionate reaction to the fact that regulations were being breached by those who had been asked by the executive members to find a different way to protest, if that's what they wanted to engage in, and we can all understand why there was a desire to protest and to make their voices heard. But at the same time, Alison, that was against the coronavirus regulations in relation to mass gatherings. I do note, however, in Belfast there was at least an element of social distancing, unlike in other places in the United Kingdom, like London, and of course the behaviour in London was quite disgraceful as well. But there was a breach of the law. I think the police acted in a proportionate way, and I know that they were working with many of the protest organisers as well to try and let them understand why this balance between protesting and actually protecting lives. And that's what the coronavirus regulations are about, protecting the lives of people right across Northern Ireland, and we don't want to put anybody's life at risk, which is why we advise people to find a different way to protest.
Yeah, I mean, I think like everyone else, I mean, I was absolutely appalled at the killing of George Floyd and the events that have followed in America. I think that certainly on Saturday I joined with others on an online protest to show my depth of feeling, and I think that, you know, in any ordinary circumstances I would have been on the streets protesting along with everybody else. But the regulations are in place to try and save lives, and I think that you know, the approach at the weekend was proportionate, but I do think it needs to be consistent. You know, if people break the rules, then the policing response to that needs to be consistent.
And can I also ask, just as a follow-up, you've already spoken about trying to get the economy up and running, hospitality and tourism being a big part of that. Why has the stance changed in relation to the 14-day quarantine for travellers? Because previously, when other parts of Europe had a quarantine in place, it was seen that it wasn't needed here. Now, obviously, they're opening up from their quarantine, and we're actually going into a 14-day quarantine for people coming to the north. Why has the stance changed in relation to that?
It's because of the transmission of the virus within the host country and what level it's at in comparison to other countries that are coming in to the UK. So that's why the quarantine position is there. Obviously, it'll have to be reviewed as virus levels change in different countries, and that's why there's been some conversations around air bridges to places with very low levels of coronavirus. So take New Zealand, for example, where coronavirus appears to be all but eradicated. You know, how can we manage travel to New Zealand backwards and forwards for those people who want to do that? So it will be, I think it's every 3 weeks the quarantine regulations are reviewed, so it'll be a continuous review, much in the same way as the coronavirus regulations are reviewed as well, Alison.
I think that covers it, yeah.
Hi, Ralph, go ahead.
Hi, Ministers. I hope you can hear me okay.
Can indeed.
Good. I wanted to ask, it was following on from the isolation, people coming into the UK from abroad. With the regulations in place that anyone is required to isolate for a 2-week period, the PSNI stated last night that the exact nature of their role in policing this is currently under discussion. Do you both think that this rule is a waste of time, as the PSNI aren't even sure how to police this? And would you accept that it's not workable?
Well, I certainly don't think it's a waste of time because obviously if people are coming in from places where coronavirus, the transmission rate is higher, then we run the risk of people carrying the virus back into the United Kingdom again. That's certainly not something we want to see happening. We want to try and eradicate it from Northern Ireland. That's what we're focused on doing. It's what we've spent this past number of months trying to do. So it's important that we try and manage all of that. Undoubtedly, this of course is a reserve matter and is dealt with at Westminster, but we'll have to work with the UK Borders Agency to try and make sure that it is operable when visitors come. At the moment, we have very few visitors coming into Northern Ireland, but obviously that will rise again as the lockdown restrictions are lifted.
And there's no doubt it's very challenging. It's very challenging to enforce. We look carefully at, for example, the level of fines that would be associated with not complying. No doubt that it's difficult for the PSNI across many of the regulations to be able to enforce it, but we continue to work with them to make sure that the people apply to the or comply with the regulations as drafted.
And just a follow-up question, it's in regards to the PSNI's new look proposals. So specifically about the proposal to drop Northern Ireland from the crest. Is this something that the Chief Constable you think should be bringing to the Executive if he hasn't already done so? And just to get your thoughts on the proposals themselves.
Well, as I understand it, there's no change in relation to the name of Police Service of Northern Ireland. This is a branding issue, and therefore, as such, it's not something that would ordinarily be brought to the Northern Ireland Executive. I'm not even sure it was brought to the Justice Minister because it's in the purview of the Chief Constable himself. Undoubtedly, there are some people concerned about the name change, but as I understand it, the operational name remains the same. This is just a branding issue.
And I'm assuming that information would go to the policing board, where
Yes.
all colleagues would have a chance to scrutinise and to input into the decision to rebrand.
Thank you.
Thank you.